I have to talk about bone grafts very frequently on a day-to-day basis here. And the reason for that is because we want to make sure that you always have all the teeth that you should have. And when you lose a tooth, that bone that used to hold that tooth starts to dissolve away. It exists only to hold that tooth. So when the tooth's gone, it starts to atrophy and we start having issues with putting an implant there to give you your tooth back. So that's why we talk about bone grafts, because if you don't have enough bone, we can generally rebuild enough to allow the implant to be placed where it should be to give you the tooth that you need. But there's also a lot of different types of bone grafts, and people always want to know, what am I talking about when I say bone graft? And there's a pretty big spectrum there. The easiest, most straightforward, least expensive, least painful kind of thing in the world is when the tooth comes out, that very same minute, we put in a bone graft. And that means we're just filling the socket that used to hold the tooth with bone.